look at the field of laboratory medicine, you'll find that it's one of those rare healthcare professions that is female heavy, or in terms of it's female dominated. However, we still have our own barriers and challenges, especially when it comes to recognition in various leadership roles, or possibly getting questioned about your knowledge or your expertise, maybe being questioned about your decision making even.
So I think what typically happens, I tend to be a pleaser. It's kind of my nature. And you can find that you can very quickly become a doormat. I think that's one of the biggest struggles a lot of women have is how do you say no?
Biggest challenge that frustrated me, and I know many of my other colleagues, is that a man can be assertive and they can be looked up to because they are assertive and direct and good leaders, whereas the same words may come out of our mouths and we're perceived more as being difficult.
Some of the things that women experience are very similar. Being mansplained is a big one. Being spoken over in meetings when you have a great idea and all of a sudden the man repeats it and now it's his great idea. And I think that's something a lot of us go through as women in the laboratory.
Even being a part of a female-dominated profession, I would say that we still have our challenges in really bringing our seat to the table when we talk about leadership in particular.
And I have found ways of pushing back. And my strategy for it, ask the question, why am I being asked to do this? Not that I'm saying no, but let me get a little bit more information and see whether or not it's appropriate for me or somebody else to be doing it. I've gotten very cautious over the years to not dilute what my attention is being focused on. Because I have a job to do, it's very clear to me what my job is and where I need to get. And I'll find that I'm being asked to do things that are not value added to my role, and are more often than not almost being given to me by virtue of the fact that I'm, quote, a nice person.
I do believe that, as women, we have to speak up. We have to be the voice. If we have a seat at the table, we have to take full advantage. There are people who will try to talk over. There are people who will try to shut us down. But I think it's really important that we stick to our guns, that we stay brave, and that our voices stay strong so that we can make the difference that we are destined to make.